Hello, everybody. I'm Christian Coachman, and we are back with Coffee Break with Coachman. Today, one more special guest that will talk about the beautiful world of the restorative orthodontic environment and all the beautiful things that we've been doing together with the collaboration between DSD and Align Technology. So it's a very special guest. I hope you guys will enjoy the chat. So I'm here today with Dr. David Lopes, Director of Global Clinical Products Development at Align Technology. And he's one of the first guys in Align company that came on board into the DSD idea. He was with us many years ago in one of the first discussions about how to integrate DSD and Invisalign. So he has super cool insights about how this journey has been so far, and of course an expert in Invisalign and CleanCheck as well. So as the world is asking DSD what is going on between DSD and Invisalign, I think we brought this time one of the best experts in this topic. So David, thank you so much for your time, your precious time. Thanks for being here with us for this special chat. And I want you to start after saying hello to the DSD community, introducing yourself, giving a little bit of your background so we can understand who is Dr. David Lopes.
Sure. Thank you very much, Christian. And hello to the DSD community. I feel like I listen in through WhatsApp and hear all the exciting news that comes and goes, and the results that you're all having with your patients. And it's exciting. It's exciting to be part of all that. So as Christian mentioned, I was privileged to get on board early on in 2016 with the idea that we could find a collaboration between DSD and Align that could ultimately serve our communities best and help serve our doctors in a way that they would be more empowered to take care of their patients best. My background is I graduated in 1997 from the University of California in San Francisco. And I was fortunate enough soon after graduation to work for 2 years for a dentist that was really innovative. He liked to stay on the leading edge of not only clinical dentistry, but practice management and technology. And so, fortunate for me, I joined this gentleman, and he just sort of sets the tone for the rest of my career. I give him much credit and love for doing that. And in doing that, I never really stopped. So I kept up with continuing education as often as I could do it. I was gobbling up the education and applying it into practice and learning and learning and learning, like so many of us. And it was maybe a little easier to do back then than it is now. Um, and so, in doing that, I developed a growing passion and enthusiasm for what we might call comprehensive dentistry or interdisciplinary dentistry. But in the end, just looking at our patients, oral health as a whole, and hopefully, the whole body systemically as well, but especially the oral health and aesthetics as a holistic unit, and how can we best serve patients in that way? And so that's been my driving passion in 20 plus years of practice. In 2007, I became Invisalign certified because I found that having more control over the tooth positions would really serve me well and ultimately serve my patients well as I sought to restore their function as aesthetics. So
But
I brought on.
your background was more into restorative initially.
Yeah, my background was strong into restorative. So we talked about my education with Coyce, with Dawson, with Pinky, and those institutions, aesthetics with LVI as well. And so oral bioaesthetics and trying to take the best of all these different philosophies. And, I'm very fortunate again that I made the choices I did to learn from mentors that I did. And then build a national network in North
That's a good
America of
list.
like-minded people.
Can you
Yeah,
repeat
it's a
that?
good list.
Can you repeat that list?
So
Dawson
DSD first.
Boys.
No, DSD came later in the line, but I studied with the Dawson Institute, the Pankey Institute, with Coyce as well, and others as well. That there's, you can think of the top teaching institutions, and they're all really, I feel, headed towards a common goal. We have
Yeah.
maybe different stylistic approaches, um, but I think the more exposure and more experience you get practicing with your patients, you find where your comfort zone is and what works for you. And so that was really my journey, as I think all of ours is what works for me. Um, and so with Invisalign, I brought it in because I wanted to control the position of the teeth better.
Mhm.
And then I found, wow, this actually has become quite a significant part of my practice.
How was
And
that moment? How was that moment, David? Because I think it sounds obvious after you bring uh, orthodontics as a restorative dentist, after you bring orthodontics into your world. And Invisalign actually made that happen for so many dentists that, through Invisalign, were able to bring orthodontics into their thinking process, because before that, you were just referring to an orthodontist away from you and hoping that somehow communication would go. And then suddenly, you see restorative dentists falling in love with orthodontics. Yeah, the same, probably similar to what happened to me. I'm not an orthodontist, but I always say that I, I'm in love with orthodontics because, when you do the proper thinking process and you design smiles in harmony with faces, you naturally see the beauty of moving teeth to facilitate that final outcome. So how was that moment? Did you used to work with an orthodontist, a classic orthodontist before? Did you moved into working with an orthodontist that was expert on Invisalign, or did you prepare yourself to become the Invisalign expert instead of creating this relationship with an orthodontist? Or you were doing just the simple cases and referring the complex cases? How was that moment for you?
yes, to all of that. I'd be lying if I said it was an obvious, seamless transition. I think, like a lot of dentists, we're trained, we're taught, we learn to take teeth where they are in the condition they're in, broken, whatever they might be, and then we try to become very good at restoring the function and the aesthetics of those teeth. But we are not really taught to think about, are the teeth in the best position they could be in? And so I fell into that too. I referred to orthodontists, like you said. I probably did so more than the average general dentist was doing. But could I have referred more? Yes, absolutely. Especially if it's mild movements. We'll just restore them. They're not going to go to the orthodontist. It's not worth it. So what happens is you really overlook a big bulk of your patients that would still benefit health and aesthetic wise from moving the teeth.
Yeah.
When I brought Invisalign in, it wasn't that I all of a sudden started doing a lot of Invisalign. It was a really organic learning curve for my practice. And that's part of what my mission is at Align, to be honest, is to not have it be such a self-reliant learning experience for the dentist, is that we at Align, and working with DSD as an example, is we try to guide these doctors down the path so they can realize the benefits of moving the teeth. So it wasn't an easy little switch that went off for me at
Yeah.
all. It took years.
It's something that grows inside you, in my case, as a technician, I became a technician that was I was specializing myself. I usually say, first, if you're not an orthodontist, first step, you need to convince you about the beauty of moving teeth, because usually you want to skip that. You want to find a way not to even mention about this to the patients. For some reason, restorative dentists in general are always even fighting against the option of moving teeth, because
We're taught that way.
yeah, it's like you're gonna lose business, you're gonna maybe lose your patient, the patient is not gonna be motivated enough. So I used to have dentists sending me cases for diagnostic wax ups and saying, Christian, do the wax up. And I would call them back and say, this is definitely an ortho restorative case. And the dentist would say, nah, forget about it. Don't even worry. Patient's going to say no. And I would say, but you didn't even offer. So I realized that the first challenge is for us as professionals to see the beauty of moving teeth and why it's good for the patient, right? Then the second challenge was to convince the dentist to move. And then to together convince the patient, right? How was the convincing your partners, convincing your associates or your team members, and then early days, how was for you to start seeing orthodontics in every other case and having to convince the patients?
Yeah, well, the team members would get on pretty quickly because they could recognize, especially I guess in trusting me, but in recognizing the benefit to our patients. So, our philosophy is how can we serve them best, and so that was pretty easy story to tell. And when I talk to dentists about this mind shift you're talking about, I think you'll appreciate this. Is I say go back to when you learned how to do denture setups, and I know that you refer to the denture setup sort of philosophy when you look at smile design. And so if you were handed a denture setup where the teeth were out of alignment and one tooth's here and one tooth's there, and you're instructed to improve it and fix it, would we just get our hammer out and start adding composite to the teeth? No, we would get our heating instrument, our waxing instrument, and move the
And
teeth in the right place.
trimming the denture teeth
Yeah,
instead of moving it in the wax.
exactly. So on one hand, we're taught to think that way, but on so many other examples, we're taught to just fix it where it's at and do what you got to do. And so I like to just remind dentists, hey, you're actually really good at repositioning teeth. You were taught to do it perhaps better than anyone else in this world. You know where the teeth should line up. You know what looks best, facially driven aesthetics and so forth. So trust that. It's the tool that becomes the trick is how do you achieve that? Now you don't have a heating element or a waxing instrument. You have ClinCheck, you have Invisalign, you have clear aligners. So learn how to use that, get on the journey, get better at it, and there you go.
I really love that analogy. I'm gonna repeat this analogy, and I'm gonna ask permission to add to my lecture.
I stole part of it from you.
That is a great analogy. Everybody that is listening, let's repeat this. When you are looking at a patient that needs a better smile, I would say at least two-thirds of them, two-thirds of the people out there in the world that deserves a better smile probably need the combination between ortho and restorative. Not neither just ortho, neither just restorative, but the combination. Two-thirds of the patients out there deserve that combination. And when you think about the shortcut of jumping over ortho to go restoratively, you're exactly doing what you just mentioned, David. You're taking a denture at the setup phase, trying the denture in the mouth with the denture teeth over wax. And when the teeth are on the wrong position, instead of just moving the teeth in the wax, you're adding composite over the denture teeth or trimming them down with the handpiece. That's exactly
Yeah.
what we do with restorative if we don't use ortho. That's a great analogy. I love that. I love that. And that's so much into what we preconize today. And that's the reason why DSD courses became almost like a process of helping people to see the beauty of moving teeth, right? Now,
Mm-hmm.
as we fall in love with moving teeth, tell me a little bit more about from a clinician. You probably had your own office. You were working, do you still practice in your own office? You work full time with Align. How did you start working with Align as the company?
So in 2016, I approached Align. I was thinking of speaking. So I thought, yeah, I want to have a bigger impact and challenges and so forth. But that just so happened to have the timing with Align was really embarking on a very intentional mission to connect better with general dentists, to serve them better, to understand them better. And so there was a collision of timing, to be honest. And then as people may learn about Align, if you work there, it becomes a all-consuming endeavor. So I took a break from practice, and
Mm-hmm.
I've been with Align full time since 2016 because it really lit up the passion in me that how many times I've seen it had a new patient come in my practice and often break down into tears just during the consultation, the interview, and the exam, helping them understand if they've had a difficult story dentally up to that point, broken teeth, missing teeth, and so forth, and they never understood why. It's a very helpless feeling as you're spending money and trying to improve your health and aesthetics, and you keep failing at it. So when I would help them see why, and a lot of that often went to a root cause of malocclusion or traumatic occlusion and so forth, it felt like they gave them hope because now they realize, okay, if that's what it is, then how do we deal with it? And
Mm-hmm.
so I felt that by joining Align has a large footprint, obviously a big platform to speak to. Is that if I could help other dentists in the community raise that bar so that more people benefit from that knowledge, empower them to make the choices that are good for them, then I feel that's a success.
Fantastic. And just to emphasize one of the topics that I realized was very important because um, as we start working a lot with the combination ortho restorative, of course, the advantages start to become clear. But I started to realize that before it was clear to me the advantages of moving teeth, the advantages were just not clear. That's obvious. It
Hmm. Hmm.
became clear, but it wasn't. And I realized that many dentists, when I asked them, so you better consider moving teeth, uh, and the dentist will say, but what are the exact advantages of moving teeth? What are the
Hmm.
real advantages for the patient long term for his life? Why should I invest energy to convince the patient to move her or his teeth? So uh, on the course we started to list them to make them clear, because I realized it wasn't clear, not even to me, and having bullet points. You said you should move teeth because of this. These are the advantages. If you could
Hmm.
summarize some of the main advantages that you think every dentist should have at the top of their mind when they see the possibility of moving teeth, the things that they should say to their patients: you should move teeth, not only because of aesthetics, because aesthetics is the obvious one. You align your
Hmm.
teeth and your smile is going to look better, and then maybe we add
Hmm.
some restorations on top of it, and
Hmm.
you're going to have an aesthetic advantage that is obvious. But besides the aesthetic advantages, what are the main advantages of moving teeth for the human being sitting in front of you, your patient?
Okay, so I do think the health and aesthetics are both important. So I will get to the aesthetics, even though you said hold off on that. But what I find is that when you're speaking to either patients or doctors, once you just sort of illuminate the obvious to them, they get it. So, for example, to dentists, when you're sitting down with a patient and you have to do some sort of either simple restorative or more advanced, and their teeth are misaligned, the contacts are uneven between the teeth, adjacent teeth, the opposing teeth. Think about when you're in that environment working. Is the sweat coming down your forehead? Is it more stressful? Does the appointment take longer? Are you stressing the restorative material properties that you're using, over bulking surfaces? Or compare it to when you're sitting down with a patient and the teeth are aligned pretty. We all see that as a celebration, because now we can really operate. We can do our craft. We can operate at our optimal performance because the teeth in the right position. So when I present that to the dentist, they're like, "Of course, it's much easier that way. I get much better results." And I go, "Well, why don't we try to do that as much as we can? Why do we want to go the other way?" And then to patients, is for the health, obviously, is if the teeth are in the right position, you ask doctors, are you going to cut less or more on the teeth? Well, if they're in the wrong position, I either am going to cut more if it's subtraction, or I got to add more material and overbulk the surfaces. And so they realize, well, it's much healthier, right? If I get it in the right position, do as little damage or trauma to the teeth as possible, use the restorative materials to their optimal ability and aesthetics and optical properties. It is when you state all of these obvious reasons, the
Mhm,
light bulbs just start going off.
mhm,
And
mhm,
for patients, if you are able to show them the difference of not moving the teeth versus moving them, such as in our collaboration that we do together,
mhm.
where the patients can see a visualization of when their teeth have moved versus not moved, and how much tooth might have to be cut off if we don't move the teeth. It's a big deal.
So if we could list, let's say, besides, of course, aligning teeth will make your smile look better. That's number
Hmm.
one. Number two, we can say that aligning teeth will also align your gum, and because of that, will eliminate or reduce the invasiveness of gum surgeries. That's probably another advantage.
Hmm.
The other one, one of the major ones, restore the smile with minimally invasive procedures. When you position the teeth properly, you don't overcompensate the problems with aggressive preps to try to save. We say prosthetic orthodontics, right? Because many
Hmm.
dentists, they say, no, but I can fix that with crowns and veneers. We don't need to do ortho. First, you're going to have to destroy more of the teeth to do that magic. And second, you're going to fake an ideal position. So the crowns with the new restorations will look okay, but underneath that, the tooth on the wrong position will also have wrong load distribution, right? The position
Hmm.
in the bone is wrong. So the chances of relapse are bigger. The chance of having problems because the load is not going down the axis of the teeth inside the bone properly. Um, you mentioned as well hygiene. If it's more difficult for the dentist to clean crooked teeth, crowded teeth, it's more difficult for the patients as well to to maintain their
Yeah,
teeth.
it helps the longevity of the teeth and the restoration. So, the minimally invasive uh, part of it, that element is massive, right? As far as health benefit, whether it's gum and bone tissue or it's dental hard tissue. So minimally invasive, most dentists would, in fact, virtually all would agree, yes, that's the right way to go. Okay, well, move the teeth, and that way you can go in that direction more often. But also the longevity. You talk to patients who've had multiple restorations fail, or maybe they've lost a tooth, maybe the implants even failed, and because they don't have the functional occlusion, the right contacts between the teeth. And it doesn't take, it's not that hard to have patients understand the value of when these teeth hit and the others don't, that takes stress off those other teeth. And that's why you had, such and such happen on those other teeth. Um, and you'll often get patients who will get on board quite enthusiastically because they don't want to have more dentistry through their life. They want to have little to no dentistry.
Yeah. The other thing that we need to highlight is the fact that every restorative procedure is the beginning of the journey that ends with the death of the tooth. We know that
Mm-hmm.
it's one prep that becomes a second prep because restorations will last only 10 to 20 years. So nowadays people are living up to 100, and if you do a set of veneers when you're 30, you're probably going to have to change, you know, 3 times, and the preps will get more and more aggressive. Some of the teeth will probably end up with pain and endo, and when you go into endo after a few years, you're probably having issues with that, and some of them will go into extraction and implant. So we know how that journey goes. So the
Mm-hmm.
more we can postpone the beginning, and the more as we start the journey, we start on the most minimally invasive way, of course, is the best for the patient. We just need to educate the patient. And that's one of the beautiful things that Align is doing, educating the patient. And patients are demanding, don't touch my teeth. And it's beautiful to see that today, because of the restorative materials that are so strong and delicate, and bonding procedures, we can make beautiful restorations with 0.2, 0.3 millimeters. What does that mean? That every tooth can become beautiful with an addition of 0.3 thickness in ceramics. And that means that every tooth in the right position can add 0.3 without almost touching the enamel. So
Mm-hmm.
tooth preparation should be almost banned from restorative dentistry if we move teeth before. You agree with that?
Yeah, it can be greatly minimized, for sure, and it should be. You're reminding me also, Christian, when speaking to patients, you talk about this journey. Once you start cutting on the teeth, it's a really tragic journey that this
Yeah.
patient and their teeth are going through. And so many of the patients have traveled that journey. And when you sit down, you're able to show them really make it clear to them where they're at right now and the risky path that they may be on, or maybe it's a good path, but in this case, a risky path. So using
Mhm.
iTero, for example, so a scanner that can clearly show a patient visually the condition of their teeth. Are they worn teeth? Are they chipped teeth? Are they shortened? Are there heavy contact points that correlate with that? Do you see recession of the bone and gum tissue that correlates with the heavy contact? And with tools like that, where technology has caught up to us, where we can show patients in a matter of minutes their story and their risk going forward, that helps them because then they can pick a different story. They can say, I don't like that story. Show me
Yeah.
a better one. And show me,
Yeah.
for example, like a mock up that you would do a DSD, or some
Mhm.
sort of visualization of where they can have hope for a better future.
Mhm. Mhm. Now, there's another comparison that I do that I want to see with you as an expert, if you agree with that. Another great complaint or a difficulty from selling orthodontics to adults is always there's the time issue, right? Patients are
Mm-hmm.
complaining, I want 10 veneers, 2 appointments, 2 weeks, I'm done. Don't try to convince me about orthodontics. I don't want that. So time is an issue that dentists should learn how to fight back, how to uh, explain the reasons why it's worth investing some time now to save time in the future. So for me, when dentists say, no, I don't want to go through the time, the patient doesn't want to waste time with orthodontics. If you put on the paper the amount of time that you're going to waste, instead of just counting the next 1 year, but counting the
Mm-hmm.
next 20 years,
Hmm.
If you don't do orthodontics, you're going to spend much more hours in the dental chair. There's a chance that you're going to spend much more hours in the dental chair than if you invest 6 precious months maybe to put your teeth where they belong, do much more minimally invasive dentistry, preserve the structures, and do delicate approach. And probably on the next 20, 30 years, you will never regret, the patient that goes through that and understands that will never regret in 20 years. Oh my God, I wish I didn't do orthodontics 20 years ago. Do you agree with that?
Absolutely. I don't know if I've had a patient really complain about having wished they never gone through it because they realize the benefits coming to the other side. The cost economically, like you said, and biologically to their body down the road is heightened. I mean, that's like you said, that's just a fact of when you have to be more aggressive restoratively. Um, Also, that the barrier of time is an interesting moment. I hear that from doctors, and I do have the privilege of talking and speaking, interviewing doctors, globally, and you get a lot of different stories. But when you hear about the time barrier, is that if your patients understood the value, even if they understood just a fraction of the value that would be served by what is a surprisingly short duration of treatment, because
Mhm.
they think orthodontics, they think wires and brackets and years of treatment, and it sounds overwhelming to your typical patient. But when they realize, really, with these clear aligners that no one can really see, and in 4 to 8 months, I could set up success for the rest of my life, at least set it up much more predictably.
Mhm.
When they start to understand that, it isn't such a barrier at the time anymore. I found that personally.
Yeah, it's very easy to understand. What brings me to the point that I believe that the main problem is actually helping dentists to become better storytellers when it comes to why you should invest
Mhm.
a few months to move your teeth. We cannot blame the patient for saying no to orthodontics. I always tell dentists, if a patient says no, I don't want to do orthodontics, I always blame myself. If I see that for that human being, moving teeth is the best for that person, I need to use my best tools in terms of communication and storytelling to make that patient say, wow, I understand. There's no way I'm not going to do this. I will do this. It doesn't matter. I know it's going to take 6 months, but I got it. I got it. So it's really very nice when you start putting the thinking process together of how to build the story and how to defend your position. So the patients will say, I understand, I understand. Let's do it. So that brings me actually to the next topic here. When you started seeing the benefits of moving teeth on your restorative cases at that time, we are probably talking uh, 15 years ago, something like that. You know, how was your journey in terms of looking at the first time Invisalign? When was the first time you heard about Invisalign or you saw I still remember today the first time I saw a video about
Mhm.
Invisalign, the 3D
Yeah,
simulation and the clear
yeah.
line. And I was like, oh my God, this is it, right? When was that moment for you?
Well, it's similar to early on is when you realize that how technology has caught up to our treatment goals. So instead of going to ortho and you're going into the wires and brackets where the visualization of what the outcome will be is up in your head or in the orthodontist's head. And then changing that to what you can see on a screen and you can treatment plan right in front of you for yourself or the patient and your team members that was a big light bulb moment. It's like this is my world. I love treatment planning visually. That's what I do. That's what I do in my head. Now I have it in front of me on a monitor. And so to me, the power of ClinCheck as an intuitive tool for general dentists is astronomical. It's
Mm-hmm.
what we do every day when we think of how we're going to fix teeth.
Mm-hmm.
And so when I started to realize that and play more with it and some of the tools that ClinCheck has, I found that I was in a very, very comfortable treatment planning experience, um, and one that I honestly wish I had even more in some of my restorative
Mm-hmm.
treatments to have that sort of benefit of visualizing the outcomes before embarking
Yeah.
so clearly. So that was those were my light bulb moments. Visualization, being able to see it before starting.
And when was that? What year was that?
That would have been 2007. That's when I started doing Invisalign. Before that, it was referring to the orthodontists and not being able to visualize visualize it as clearly.
And today, um, you still do you have a division in your clinic in terms of cases, complex cases, simple cases, a simple you do with your restorative, with your ortho knowledge without being an orthodontist, how far you go in terms of complexity, in terms of orthodontic issues, and do you still refer to an orthodontic specialist some of the cases? How do you manage this filter?
Okay, so we'll have to play pretend a little bit because I'm not practicing right now.
Yeah.
But I would handle that like I would recommend to the dentist that I speak to is we're all somewhere on this journey of just learning whatever it is, something. In this case, Invisalign, maybe when you first learned how to do crowns and fillings and so forth. And then you travel the road, and those that are very advanced in their capabilities. So we're all somewhere along that. And so being real and honest about where you are on that and what it takes to move along that if you desire is one thing. So when you look at cases, there's certain ways to look at a case. So for example, if it's a significant class 2 case that really would need substantial anterior posterior correction, and my capabilities as an Invisalign provider is, maybe I'm an intermediate to less experienced provider. That's probably not going to be a case that I would be the best to serve the patients with. So I want to consider a referral in that case. But I know enough to then interact with my orthodontist
Yeah.
to get the right result I'm after. And that's
Mhm.
part of the power of Invisalign too, is you can co-treatment plan. Because I
Mhm.
know what it should look like in the end. I'm just not confident on how to get there. And
Mhm. Mhm.
that's where you start using a product like Invisalign, where you get more experience, more repetition, and learn more as you build up your proficiencies.
Mhm.
But so many of the cases, especially pre-restoratively, are mild to moderate movements. In 4 to 8 months, you can move teeth a lot. You could treat up to 7, maybe even 8 millimeters of crowding, overjet or overbite, open bite, deep bite conditions, misalignments. There's a lot you can do in that amount of time, especially if you're setting up for restorative.
But I think you brought out a very important topic. I believe that the clean check idea of visualizing first and acting, cheers, and acting afterwards, visualizing first is not only visualizing for yourself, it's also visualizing as a team. It's not about you doing everything yourself, but even when you refer, if you refer inside the 3D digital environment, you can start from a smile design, you can overlap the files, you can see where you want to be, and you can interact with an orthodontist, a specialist, in a much higher level. We are talking about visually bringing everybody to the same page, to the same picture, visualizing the same goal, and being able to understand and quality control the process, check the process, you know,
Mm-hmm.
uh, of,
Absolutely.
of every moment you can actually see. It's just so obvious today. How can you not use this technology to plan your cases, communicate with the specialist, check the process, reevaluate, and in a very close position to what you plan.
Yeah, I think again that's an example to me of also where the technology has continued to catch up with us on what we try to do for our patients, and so many of us as practicing dentists still think of how it used to be. Like to go through ortho sound like a big deal,
Mhm.
and it certainly doesn't have to be. If you could just need to move a few teeth just a little bit to really get a better result or a
Mhm.
healthier result for your patient, it's so easy now,
Mhm.
and
Yeah.
you can visualize it before you start, and it doesn't require an uncomfortable experience for the patient.
I think you touched a very important point. We still have in our mind, if you come to a restorative dentist, you want to improve your smile. The restorative dentist will do things, in a few weeks or a few months, solve the problem. But if you have a case, oh my God, no, we need ortho. It's like gone, right? It's like I see you in 2 years. You're gonna suffer for 2 years, and you're gonna
Mm-hmm.
have a horrible smile for 2 years, and you're gonna only see the benefits at the end. And today, what I see is that restorative dentists should see ortho as the same way we learn to see gingivoplasty. Today for
Mm-hmm.
restorative dentists is very clear. They see the misalignment of the gum, they draw a line on the picture. They see the lip. They say, "Oh, we need to crown length," and that became a normal thing. We crown length, and we wait 3 months, 3 4 months. We prep your teeth. We do the veneers.
Mm-hmm.
That's easy for the GP to see and to talk about it and to convince the patient. Now, orthodontics came to the same position where you can see, no, your case is an ortho restorative. You know, we're gonna do aligners. You're gonna have beautiful 4 months. You're not gonna suffer. Nothing's gonna happen bad.
Mm-hmm.
Just gonna have a 3-4 months journey. We're gonna have all these benefits, and then we're gonna do the veneers. You know, we're gonna restore. We're gonna do the composite, whatever. So I think that
Mm-hmm.
because of Invisalign today, easy composite restorations or easy bonding, easy gingivoplasty, and easy orthodontics. It's what we call
Mm-hmm.
light dentistry. For me, one of the most powerful concepts that we are working now, because it is easy. It's easy to move teeth, it's easy to align the gum, and it's easy to restore the teeth and the smile in a beautiful way. So,
Yeah.
uh, we need to help people to change their perception, right?
Yeah, and I think sometimes when I hear you speaking to, this principles of smile design is that we still have the large majority of our colleagues that either don't apply that, maybe they're aware of it but they're not doing it, but in some way it's not showing in their results for their work. So you
Mm-hmm.
see someone come to you, a patient that's had, some smile work, and their gingival architecture is like this, and you're
Mm-hmm.
like, oh my goodness, how could you call that the best result? But yet, I'm imagining when I talk to these dentists, part of it is that even though they know that ideally they'd have those gingivas lined up, again, it sounds like a big deal. I'm going to have to cut. I'm going to have to do this. I'm going to have to refer there. And then to do light dentistry, which is the technique that I do love, I agree with you completely, is to be able to now just add composite conservatively. If your incisal edges are all lined up and the gingiva is like this, then you haven't set yourself up for being able to restore the incisal edges properly to length and width of the teeth.
Mm-hmm.
So move the teeth, move the gums, get the gums lined up orthodontically, and then you're able to do the light dentistry technique so well. I think it's the ease of doing it that escapes, unfortunately, many of the dentists still. So to get that word out is a mission for myself.
And technically speaking, why, we know that Invisalign, for me, it's not the concept, the brand, and the commercial part of the discussion. For me, the beauty here is really allowing people to take advantage of moving teeth. That's the number one, and the helping dentists to have a better story for their patients. That's the
Yeah.
number one thing that Invisalign became the number one dental company in the world because they transformed the solution into something that dentists can easily share the benefits to the patient, right?
Hmm.
Uh, Moving teeth in an easy way without looking like a teenager, and being able to have a normal life during the 6 months that you're moving teeth, have a normal
Yeah.
life, right? Uh, and one of the other things that catches my attention, and I'm not an orthodontist or a biomechanist that to understand, and maybe you can highlight how Invisalign was able to shorten orthodontics, the technology and the systems that Invisalign has. Can you explain a little bit why
Sure.
orthodontics is more simple because of the Invisalign technology?
Yeah, I think that's definitely an excellent question. And naturally, I work at a line right now, so naturally I represent a line. But what I'm going to share now is quite truthful, just as a doctor's impression. Okay, because like you said, at the end of the day, whatever techniques used, we hope our patients get the healthiest outcomes they can get and the best results. But where's a line's advantage? They've been doing this 20 years, 20 over 6 million smiles
Mm-hmm.
now have been treated with Invisalign. Many of those very, very complex corrections as well. And so when you have that sort of experience and database where you have teams working globally every day to learn as much as possible from what we've encountered there, the good, the challenges, all of that, and have the doctors that can help you to develop all that, I mean that's just a natural advantage to being able to tweak and perfect your product. And so we have what are called our smart technologies. We have Smart Track, which is our device itself. So not all plastic is created equal. And, we
Yeah.
like to say, but it's true. The plastic itself can generate forces on the teeth that are unprecedented compared to the evolution of third plastic aligners. And that took a lot of research and development to get to that point. The smart force refers to the features we put on the teeth, the attachments, and the way the aligner engages the teeth to now optimize the movement and directionality of the movements and the magnitude and velocity of the movements. And so now you start to build efficiencies. You talked about duration of treatment. Is you have features, you have device that are built on moving teeth safely and efficiently through space, three-dimensionally. It's amazing. And you see the people that are working on this, and they're extremely dedicated to perfecting that. Then you get into the treatment planning part, and the the treatment the treatment plan for the doctor is supported by being able to visualize exactly what they want and then stage it through the course of treatment in a way that delivers an efficient, very predictable path for the patient through their treatment. So all of that combined is now you can do treatment shorter. So we have 1 week wear, for example. That's evidence-based research that has shown us that the 1 week wear will deliver the results that we're looking for. So patients can achieve, honestly, amazing results very, very quickly.
Mhm. And one of the nicest things is to be able to track the process, right? If you think about digitally simulating a movement and utilizing, and we are not even mentioning artificial intelligence that is going to start playing an amazing role from now on, multiplying the benefits of all of this, right? Yeah, you're going to see very soon the same, if you use brackets in classic orthodontics, you're a human being, one brain trying to fight with the computer that 6 million smiles and has this information saying this is the best way, not that way. We need to go this way. And we know where this is going, right? Know that computers can already do, a computer can beat the best chess player in the world. We know that a computer can make better diagnosis in many medical areas already, compared to the most experienced physicians in the world. And biomechanics is one of the first things that I believe will be substitute in terms of decision making process, because it's very mathematical, and when you analyze teeth and you analyze the arch, computers will become experts on understanding how to go from A to B, how to connect the dots.
Exactly. And the machine learning is no surprise. Machine learning and artificial intelligence is alive and well at Align, and I don't think that's surprising at all when you have that kind of database. But also, it's just reinforcing for doctors is to know point A and B, or A, B, and C. That's where the doctor um, has that knowledge, has that skill to know where to go. But the how to get there part, that's one of the most poorly understood differences that I see, especially with general dentists, is they know where they are, where the patient is, they know where they want to go, but they don't embark on that journey because they're so insecure about the overall how to get there. It's like the how to get there, we can help you with that part, like with Invisalign, so long as you stay somewhat within your capabilities. But the technology has definitely allowed more and more doctors to be able to connect those dots much easier.
We know that as technology evolves, as artificial intelligence start to make decisions for us, this will allow more and more dentists to do better movements with less issues. But still today, uh, you know, we need some expertise specifically on clean check. Clean check became almost like a specialty itself. You to relearn how to move teeth with that technology, and that's what I tell people. If you have an orthodontist that doesn't believe in aligners, you just need to change orthodontists. You need to find somebody that was open enough to reinvent themselves and relearn how to move teeth. Biomechanics is a little bit different, and the process of moving teeth is a little bit different. It's not a matter of the system working or not. It's a matter of you being an expert on that system or not. Like anything in life, you cannot blame the system. You cannot blame technology. We know, as I was surprised when I started to get in touch with Invisalign, 10 years ago, and I started to research about, because the idea of Invisalign got me in 5 minutes. I said, this is the future. There's no doubt. There's no doubt. There's a couple missing links, but whatever is missing now, technology will solve that problem in the future. That's what I tell everybody. technology will solve. If you criticize a system right now, the only thing I can guarantee is that this problem will be solved tomorrow.
Mm-hmm.
So
Mm-hmm.
when I started to embrace this, I started to ask myself, are there out there amazing orthodontists using Invisalign for everything? Because the second excuse was, oh,
Mm-hmm.
this is only for this case, not for that case. And today we see amazing professionals doing Invisalign in absolutely every case,
Mm-hmm.
with complexity, amazing complexity, combination of tools. And it's really amazing how Invisalign created a new specialty in dentistry, and how nowadays you have aligner societies in every continent, amazing
Mm-hmm.
congresses everywhere, beautiful lectures, cases, follow-ups, and things that you cannot fight. And I'm saying that because in Brazil, the orthodontic world is still fighting against it. It's amazing. Yeah, they try to convince themselves or to say that I don't know why. It's just ridiculous. Uh, but I want you to give, maybe, of course we cannot give a clean check full course in few minutes, but if you could give some insights for the people out there that are maybe starting the journey or wanting to start the journey, how would you suggest them to start their clean check journey, and a couple of clinical tips maybe?
Sure. But I think it, the first thing is to consider ClinCheck a visual treatment planning tool. So think of, if a general dentist were to think of how they treatment plan their restorative cases, is unless they're doing a diagnostic wax up, then they're having to do that treatment planning either in their head, which we all do visually, but otherwise, maybe you're using a DPMS system and you're entering treatment plans on a piece, on a two-dimensional surface and all that. So ClinCheck is a three-dimensional way to actually treatment plan and preview the results of a case. Now, the tools itself, you learn how to use tools. One of the tools I like the best is the 3D controls. What 3D controls allows you to do is to change the position of the teeth in real time, and soon with the face right next to the 3D controls, so that you can see the results of the tooth movement with the face next to it. But think of being able to do that like you're moving denture teeth, and then at the same time see how much movement was it, how much rotation was necessary, and then to have built-in alerts in that to alert you when you have maybe gone beyond a very simple movement to one
Mm.
that's a little more difficult, so that the doctor can tell, hey, I've created the look and the setup looks that I know is right. It's all fairly simple movements. I'm confident we can do this. Let's go forward. Or I've created what I know looks right. There's a couple of teeth that require a little extra attention on movement, and I'm aware of that before I start. So the visual treatment planning ability of to modify it, know what you're getting into, be prepared before embarking. It, it's it's
So,
such a better experience.
so it's almost like a yellow flag machine,
Yeah, keeps you
raising the
safe.
flag, yeah, raising the
And when you
flag and
think of,
saying,
yeah, and when you think of treatment planning, just to keep it simple for doctors, think of your denture. I keep going back to that because I know that they get that vertical position of the teeth, and then the sagittal anterior posterior position of the teeth, and the way the teeth relate to each other, of course, also the transverse or arch form of the teeth and the alignment of the teeth along that arch. We're all very good at knowing what looks right, and the right relationships there.
mm-hmm,
And
mm-hmm.
that's how you look at your ClinCheck, and that's how you analyze it. It's very intuitive. And if you see something that doesn't look quite right, move the tooth to where it looks right. And then you can see the movements that would be necessary to get there.
Yeah, yeah, it is. I agree with you. Above all, it's a visualization tool. It,
Yeah.
it's making you see before you act. And this is, again, such an obvious concept that I would almost say that dentists should be forbidden of moving into action before seeing what their thoughts are in 3D.
Mm-hmm.
Every time you look at the patient and you think you know what the patient needs, you're jumping into conclusions that I believe that in the near future, this will not happen in dentistry, mainly because patients will not allow. That's what I say.
Mm-hmm.
We should adopt 3D visualization tools for better diagnostics and better treatment planning not because we cannot do dentistry without technology, because we used to do, but
Hmm.
because patients will demand that. Patients will demand. Patients will say
And they deserve that.
they
I'm
deserve
right there. I am right there with you on that. And you think of our collaboration that we have together for the doctors that are treating their patients with the DSD Align Invisalign collaboration is you guys will set up this smile design, right? You're going to help them treatment plan. What does it need to look like in the end that's not quite right? That gives us the framework to know where we need to move the teeth. And if there's a discrepancy there, then we can work it out. Well, maybe we need to compromise here or compromise there. It's all done on a blueprint, like I know you
that.
like to speak to, the blueprint that's reproducible within the mouth
Mhm,
all
mhm,
before you get started. So when it comes to moving the teeth, it becomes a very guided experience. Well, I need to move it to so that I can put that restoration there or to even it up where there will be another restored tooth. It just all becomes very, very guided.
mhm,
Invisalign Go is an example of where we designed a product specific to guide less experienced doctors on the journey to build up some confidence and repetition.
mhm,
It
mhm.
helps them select the right cases. So case selection is really important, that you
Yeah,
don't jump
yeah.
into a really difficult case before you're prepared to do so. So we
Mhm,
have a product called Invisalign Go that guides doctors on selecting the right case, keep them in a very predictable arena of treatment with
mhm.
simple movements that can achieve quite a bit, so the doctors can get very confident.
So Invisalign Go, if I'm an Invisalign Go provider and I submit a case, uh, Invisalign Go technology will give me back a response saying this is an Invisalign Go case or it's not. Is that right?
Yeah, so that's what we call case assessment. So the doctors through photography. So our software is reading the photography. If you have a scanner, it'll read the 3D image as well, which is obviously even that much more useful. But it'll read it until within 30 seconds or less. Will tell you which movements are simple, which movements are more difficult, and if the overall treatment goals are easy and go forth with treatment, or whether you ought to consider looking at the treatment plan before moving forward. So the
Mhm.
doctor can make an informed decision by looking at the treatment plan itself.
Yeah, that for me is one of the most beautiful things about, again, you're talking about Align as a company, and I'm a fan of Align as a company because of many reasons, and I repeat that, and I don't want to sound biased or something like that, but because of that, because you can develop a tool or a solution, and you can go to the market and push people to buy your solution as much as possible, but suddenly you're working on developing technology not to sell your solution as the first goal, but to help the dental community to see what type of case you're dealing with. This
Mm-hmm.
is amazing. It's only win-win-win. It's a beautiful situation where a company is not developing a solution mainly to sell more products, but the main goal is to help you see what type of patient is ahead of you, and can you use our tool ideally for that case, or should you even uh, get in touch with a better expert, refer to somebody. So this is what I see, why I see that every company should be inspired by a line in terms of not trying to push sales up purely, but trying to bring solutions to help dentists to do better. And I can use as an example the implant companies, instead
Mm-hmm.
of trying to like every implant company is always pushing, trying to make us buy more implants. Imagine if implant companies, instead of that, would invest on trying to help us diagnose if the tooth needs to be extracted or not. Can you imagine that?
Mm-hmm.
An
Mm-hmm.
implant company actually helping us not to extract teeth and theoretically
Mm-hmm.
selling less implants. But we know that the company that thinks like this will win, will be the future of dentistry depends on people like that, on companies like that are looking for solutions for better dentistry, regardless if that solution is directly related to more sales or not. And this is what I see with the technology behind Invisalign itself. The yellow flags, the red flags, what type
Mm-hmm.
of case you're dealing, case assessment. Where can you go with this case? Is it an easy case? Is it a difficult case? Is
Yeah.
this Invisalign Light? Is this Invisalign Go? Is this Invisalign Comprehensive? Should you bring a specialist orthodontist on board? Can you do this yourself? This is the beauty of this technology, educating dentists. Every case becomes a learning experience. Every case becomes a learning experience. And technology learning side by side with us will become our best partner on delivering everyday dentistry, you know?
It's very powerful. I and imagine that again, the journey the dentists take on learning to do their restorative. If you're a beginning dentist, let's say in your first few years or whatever, and then you jump into a full mouth rehabilitation, increased vertical dimension, and so forth, CRCO shift, you're likely going to be in over your head, but you didn't have the foresight to have someone tell you or have something tell you, hey, you know what? That case may not be the case right now. And that's
Mhm.
the sort of guided technology, I call it guided technology we're trying to provide, is the way we all get better is
Yeah,
we do more. We
yeah,
repetition and learn from others. And so with the case assessment Invisalign Go, that's the goal,
mm,
is allow the doctors to have the success, build the
mhm,
successes up so that they
mhm,
can then have confidence to become better and better at it.
mhm,
Think of too, if they don't have that confidence, how many patients go into a general dentistry practice or an aesthetic dentistry practice or whatever, and they have occlusal disease, some level of it, and they leave that practice and they still have the occlusal disease and they don't even know it. No one
yeah,
has alerted them to it. No one has helped them treat it.
yeah,
To me,
yeah,
that's unacceptable. We have to do better there, and
yeah.
that's where hopefully together with DSD and with Invisalign, and that we can accomplish some improvement there.
We are all learning. The companies are learning. The companies that are willing to learn with this journey, and not only selling but learning with the journey and providing better solutions. I think the learning process, as you said, is for us dentists, every clinician, it is one repetition, as you said, and technology is the best way to teach ourselves because you
Mm-hmm.
can track everything and you can compare, and every case becomes a learning experience. And the other way to learn is to learn from each other, is communication. And again, without 3D visual communication, we miss the opportunity of learning every day. 3D visual communication allows us to bring everybody on board and express this is where we want to be, how do we get there, and then we learn much more from each other than trying on the phone through words, lost in space, trying to explain where do you want to be, what type of treatment. This is the old way of communicating that makes people even giving up on teaching each other. Just leave it with me. I know what to do. Don't worry. And you don't actually communicate in a learning level. So I believe that
Mm-hmm.
3D technology has the power of speeding up the curve, the learning curve. And what we are trying to do with DSD is 100% towards that. And Invisalign was the pioneer on that in terms of uh, allowing us to see, to learn, to track our mistakes, to overlap the cases, to understand what works and what doesn't work, become better for the next case, right? Become better for the
Yeah.
next case. And we see
I,
that without technology, people are doing the same mistakes for 30 years, 40 years,
mm-hmm.
because it's hard to see. It's hard to see.
Just to circle it back to, I know a place that's especially you identify with, is the idea of the blueprint. Well, I think of an industry that recognized the necessity for three-dimensional drawings, architecture, engineering for a
Yeah,
building. You're building a house. Can you imagine building a house and just have some scribbled notes on a piece of paper?
yeah,
That would seem like insanity to people. And so they had their analog drawn three-dimensional plans, but they did recognize we need a three-dimensional plan to move forward. And of course, with digital technology now, that becomes commonplace. And so for dentistry, we're building, we're creating.
yeah.
It should be three-dimensional. It should be
Smile
a
architect.
digital experience. Yeah,
Oh, smile.
exactly.
I think that's fantastic. Fantastic, David. Really, I hope the whole community will enjoy this chat. We're going to promote this all over because I really hope we're going to have thousands of people watching this video and coming back with questions. We are always open, both sides of the game, DSD and Align, more and more together on the courses, with the Itero team, the DSD app team, the DSD planning center team, the clean check team, the Invisalign experts. It's really the DSD course became an amazing experience, amazing journey towards that ideal, facially driven, holistic dental care. So it was great to have you here, David. And I want to thank you again for your time and your insights. I hope to see you in person soon
Yeah,
in one of our combined events. We're gonna be together at the DSD residency in Miami soon. So hope to see you again, and thank you for your time. It was a great pleasure for me to chat with you.
yeah. Thank you for your time and the opportunity to maybe we inspired a couple doctors,
Let's
and
hope
that would be one pebble dropped in there to send the ripple. So thank
one
you very
one
much.
one will be enough. Yes.
Yeah.
See you soon.
All right. Okay.
Bye
Take care.
bye. Ciao.